Well, welcome everybody. Welcome to this topic of conversation, this free seminar entitled How to Manage Chronic Pain. I would like to add in without pills or shots. And my name is Nick. I have a company called the Burroughs Clinic, which is dedicated to helping people out with their health issues. And this is one area or topic I'm interested in. Done a lot of research, put this slideshow together for everybody with the hopes of guiding you in the right direction if this is something you're dealing with. Okay? All right, so what is chronic pain? Many people suffer from it. There is hope and alternatives to pills and shots, which is the traditional way of treating this. So who here has had pain this week? I have. I'm doing this presentation, I've had some pain. So everybody suffers from pain. Everybody in their lifetime has had some sort of pain. Some people have a little bit, some people have a lot, some people have it all the time for various reasons. So I hope with this presentation that you'll be able to understand what pain is better, especially chronic pain, and the different approaches and how to manage it. Pain that beyond the typical healing time frame for most injuries, which is typically 3 months, 12 weeks. And with chronic pain, sometimes there isn't an underlying injury or injury that started it. Chronic pain indicates disease or malfunction in the pain portion of your nervous system, which is providing an overblown response that no longer reflects the state of your physical body. That's fancy language for the pain's still there and the physical problem could be gone. Okay, so this is me, my company, the Burroughs Clinic. Just to introduce myself, my name is Nick. I'm a physical therapist, a therapeutic movement specialist, and a primal health coach. The Burroughs Clinic is a mobile physical therapy and health clinic. And I hope to be running up full-time accepting insurance by this summer. So I better service people's needs in this area. Okay, signs and symptoms of chronic pain. Symptoms can be hard to identify and may not be easy to reproduce mechanically. So let's say somebody has chronic pain in the shoulder. It could hurt at rest, it could hurt with movement. There's no specific reproducible movement that might hurt it. That could be a sign of chronic pain, which is often a vague sensation without a clear perimeter and can spread to different regions. Sometimes with chronic pain, you have an exaggerated, amplified pain response that can occur with movement, physical touch, mental stress, or even fluctuations in weather and temperature. I've had patients in the past with chronic pain that I do feather-like pressure on their arm and they throw their arm in the air because it hurts so bad. To me, that's a sign of chronic pain and a dysfunctional response to a pain stimulus, if you want to call it a pain stimulus. Chronic pain can be a variable quality. It can be burning, sharp, achy, tingling. Whatever people use to describe pain, it can be that. Okay, some statistics on chronic pain. Chronic pain, which we've already talked about, is pain that lasts longer than 3 months for no specific reason. It is a debilitating condition that affects daily work and life activities for many adults in the U.S. and worldwide. It has been linked with depression, Alzheimer's disease, related dementias, higher suicide risk, substance use, and misuse. Chronic pain is a real thing. It happens to people. I've experienced it myself. I've seen people with it. And a stat from 2016 showed or exhibits that estimated 50 million people in the United States experience chronic pain. And with chronic pain, it can result in substantial health care cost and lost productivity. Some more stats related to chronic pain that I got off the internet. It's higher prevalence in older adults, especially those living in poverty, in females, adults that are unemployed, veterans, people in rural areas typically have a higher prevalence of chronic pain. Divorced and separated, adults with disability or chronic medical conditions. I can't give you a reason why all this might be involved, but this is what the stats say. All right, so let's get into some nerdy scientific language, and I'll try to give you a little translation at the end. So chronic pain is not simply a temporal continuum of acute pain. Studies on functional plasticity and neural circuits of pain have provided mechanistic insights and linked various modulatory factors to a change in perception and behavior. However, plasticity also occurs in the context of structural remodeling and reorganization of synapses, cells, and circuits, potentially contributing to the long-term nature of chronic pain. That is a bunch of nerdy scientific language. I get that. But what that is saying, this is my translation, your pain system is disorganized and ain't working properly. The pain system is a complex involving your central nervous system and your peripheral nervous system. That whole system is disorganized and not working properly. All right, so let's talk about the current pain module in the scientific field, the medical field. It's called the biopsychosocial model, or BPS model. So the biological component of the pain model. This component encompasses the traditional pain model, which includes looking at structure, posture, biomechanics, anatomy. These things are important because many people have pain issues that are driven by their tissues. Okay? This is an important part of the model. A lot of people with chronic pain do have certain movements they avoid because it hurts them. It causes their pain to increase. And that stays with them for a long time. So this is one component of that model. The next component of the chronic pain model is the psychological component, which is basically thoughts, emotions, and beliefs are hugely important in how you evaluate the world and your own body. At the end of the day, pain is a protective mechanism. It helps you survive. So pain is there for a reason. In chronic pain, it's there and it's working dysfunctionally, but there is a reason people have pain. What the psychological component says, it means your brain can create pain based on a perceived threat, even if there's no damage to your tissues. Pain can also be tied to stressful life events, making psychological an essential variable to consider when addressing chronic pain conditions that persist beyond the normal healing time frame. If you have chronic pain and you're not being treated psychologically, then you're doing yourself a disservice. Social component. This is something new that I learned in my research. So they find that people you interact with are another huge element in pain, chronic pain. We are becoming more and more aware of how important social interaction is to overall health, including pain. Loneliness, for example, can be a significant factor for people with pain. Lacking social engagement, or you can even say purpose in life, may predispose someone to depression. And we all know that the depression part of the brain is linked to the pain part of the brain. And from earlier, we know that depression can lead to chronic pain and vice versa. So addressing your social component is another important intervention in treating chronic pain. Okay, let's talk about current treatments. We'll briefly go over a bunch of these. A lot of these are out of my area, but I will mention those. So there's traditional medicine, there's alternative treatments. I can use quotes on that because alternative is such a wide variety of disciplines. There's counseling, and there's my specialty, physical therapy. Okay, alternative medicine. I don't know much about these. I'm just going to mention them. There's functional medicine, which involves a bunch of different types of labs and trying to balance your system out, balance your physiology out. There's traditional Chinese medicine, which is an Eastern approach, which I don't know much about. Acupuncture. Has anybody here had acupuncture before? Okay. And there's chiropractic, which a bunch of chiropractors around here. Has anybody had chiropractic treatment? Okay. Anyway, there's quote unquote alternative medicine. And there's also many others as well. Traditional medicine. Okay, all right. This is what we mostly work with in our society. These are MDs or allopathic doctors. They usually treat chronic pain with surgery, shots, or pharmaceuticals or pills. So let's talk about some of the common pain medications used for people with chronic pain.
You have non-steroidal anti-inflammatory medications, NSAIDs for short, ibuprofen, which is Advil, and naproxen sodium, which is Aleve. You have acetaminophen, Tylenol, and you have opioids, or things like Percocet, Lortab, and all those medications you see. On a side note, when I have pain, I can't get rid of it. Any other way I know, I take some Tylenol and it works great for me. But I'm not taking it all day long, so. Because there are some side effects with these medications. Okay. So on a side note, let's go ahead and move into the surgery. Surgery is not always the answer. Okay, this is something that really surprised me. I've been in the healthcare field 22 years, and when I dove deep into the literature, I was shocked to read these studies, actually. So let's just go over these. So various studies on asymptomatic or pain-free individuals found that 30 to 80% of them had a bulging disc. 34% had rotator cuff tears. 30% had meniscus degeneration in their knee. And the list goes on and on. And these people were asymptomatic. They didn't have any pain. So the physical problem in the body doesn't always match the pain symptoms. Surgeries are great for certain things, but surgeries come with risks. I've been in this business 22 years, like I said earlier. I've seen surgeries go bad. That's something you don't want to deal with. So I guess what I'm trying to say is surgery is not always the answer to dealing with pain. Moving on with the surgery question, some studies I found. A study in the Journal of Bone and Joint Surgery, 1995, by Shear et al. Revealed the MRIs identified a high prevalence of tears of rotator cuff in asymptomatic individuals, kind of on what we talked about earlier. So if we all took a scan of our bodies in here, full scan, you might find some physical problems identified by a picture, and you may or may not have symptoms. I know for a fact I have a labral tear in my right hip. I know for a fact. Do I hurt right now? I don't hurt. Sometimes it hurts, sometimes it doesn't. So just because you have a certain physical problem identified by imaging doesn't necessarily mean you have these symptoms. Okay. So these tears were increasingly frequent with advancing age and were compatible with normal painless functional activity. Back to the medications. Okay, so some side effects of medication, and I'm not anti-medication, I'm not necessarily pro-medication, I'm just giving you some information. Okay. With ibuprofen and Aleve, the NSAIDs, if you take it for a long time you could develop ulcers and GI bleeding. The Tylenol has been documented in cases it's very toxic on your liver, you can have toxicity. And with opioids, we all know about the addiction and overdose death rates in this country. Do these medicines work for pain? Yes. Is it the only answer? No, it's not. Okay. You just got to be careful when you.
What about aspirin?
Yeah, that's part of that too.
Which one?
It's an NSAID. Yeah. And there's some GI bleeding risk associated with that.
Yeah.
So.
Just been around forever.
It has, yeah. Okay, so let's move on to opioids. You hear about this all the time in the Western world, especially in the United States. Okay. Some of this might be some new information to you. But anyway, a study in the Journal of CNS Drugs in 2019 described that as opioid tolerance develops, which it often does in people who have been on them for a while, require more dose to get the same effects, and the dose increases occurs, which occurs in lots of people. Opioid-induced hyperalgesia, which is a state of hypersensitivity to pain stimuli, may occur. The more opioids you take, the higher dose, you become more sensitive to pain because it messes with your internal endogenous pain relief system. Now, over the course of time, I'm not saying if you take Lortab after a surgery, you're going to have problems, but if you're taking it for a year, you might start to develop this. Okay. So to put it bluntly, the longer you take opioids, the more sensitive you become to pain. Then you need more to get the same effect, and that's where the addiction cycle comes in. Okay. Long-term opioid use can cause your natural innate pain relief systems to become dysfunctional. Okay, all right, so
Let's talk about some government guidelines. The CDC 2022 recommendations for clinical practice in prescribing opioids for pain provides recommendations that promote a multidisciplinary approach to pain management. You should, if you have chronic pain, you should not just take pain pills. You need to have the multidisciplinary approach, which we talked about earlier. And implementation strategies to reduce disparities in pain management care. One of the interventions for chronic pain is counseling. I don't know too much about this, it's way out of my area, but I'm going to quote this study here. There's a study in the Journal of Psychological Health in 2023. Demonstrates that positive psychology interventions, or PPIs, for patients with chronic pain help decrease symptoms. Just talking to people about pain and having their outlook changed to a more positive outlook help decrease their symptoms. PPIs are defined as strategies that involve focusing on positive emotions, thoughts, and behaviors that improve mental health by increasing mental well-being and reducing psychological distress. Okay, I found that pretty fascinating. And that can encompass a bunch of different things. All right, physical therapy, my expertise, my profession. So I treat people with chronic pain all the time using these interventions as well as other interventions. Exercise or movement training, modalities, heat ice, electrostimulation, manual therapy techniques is basically anything where a therapist puts your hands on your body and does something to it. Pain neuroscience education, which is educating a person with chronic pain on what chronic pain is, that helps them understand what it is. When they understand better what it is, they're more likely to have better outcomes. And then therapeutic movement education. Okay, all right, so moving on to research and pain education. So a study in the journal Pain in 2019 entitled Pain Neuroscience Education for Adults with Chronic Musculoskeletal Pain showed that when patients were given pain neuroscience education, talking to them about pain, educating them about what pain is and how it works in your body, the components of that education can enhance pain reconceptualization. They understand it better, they reconceptualize it, and in doing so, it helps them to cope with their condition better. Education about the complexities of the pain experience help people deal with it better. There's a lot of people that have chronic pain that are so scared to move their bodies. It gets into psychology. If you educate them on the proper way to do so, and the fact that if they do it, they're not going to damage their body. That's one way to reconceptualize their pain. And if they can move better, they have more confidence and they feel better about themselves, which goes into the positive psychology interventions. All right, some more research on exercise and chronic pain. A study on the journal Pain Rep. Not sure what that stands for, but it's a journal out there. In 2017, demonstrated that regular physical activity produced pain relief through the central nervous system regulation. This is where I come into play. Moving your body, becoming physically active, exercise, whatever you want to call it, helps to regulate your central nervous system, which is composed of your brain and your spinal cord. It helps to regulate the mechanisms from there that helps you decrease your pain. A study in pain in 2001 showed that the prevalence of chronic pain symptoms was lower for both men and women who exercise regularly. So, the misconception, if you have chronic pain, you should be exercising, you should be moving your body, but you need to be doing it in an appropriate manner, okay? That's when you seek professional help to do so. Okay, some more research on exercise and chronic pain. In Pain, January 2016, a study was published that demonstrated that regular physical activity increased the percentage of natural anti-inflammatory chemical interleukin 10. That's a chemical found in your physiology naturally that helps to decrease inflammation, and we all know that decreasing inflammation decreases pain. And it showed that regular physical activity helps to increase that chemical in your body. Another study published in the journal Pain in 2015 showed that low-intensity aerobic activity reduced nerve pain. Again, moving with that same premise that moving your body and exercising regularly helps to decrease pain.
Okay, all right.
Another area I work on is diet and lifestyle. So I found this study, it's how diet and chronic pain are intermixed. I studied the journal Front Nutrition, and I think it's Frontier Nutrition, I'm not really sure, but in 2023, demonstrated that an anti-inflammatory diet, which is, there's all sorts of different anti-inflammatory diets, but this one included no gluten, low on the dairy, red meat, and avoidance of processed foods, found a decrease in overall pain and reduced symptoms of stress and depression, as well as showing improved sleep habits. So it's very true, you are what you eat. If you eat junk, you're going to feel like crap, and you're going to have increased pain. But if you clean up your diet a little bit, it can help you deal with your pain symptoms. Okay, I included 2 videos that talks about pain responses in people, because all humans are made differently. It is the craziest thing. I still don't understand people sometimes. But there's one video of an individual with extreme pain tolerance and one with extreme sensitivity. I'm going to warn you, the extreme tolerance one's some pretty serious stuff. So just be aware, if it's too much to handle, just turn your head. Let's see if I can bring these up here.
Defeating a criminal who tries to attack you is surprisingly simple. You just need to follow the Romanian rainbows. Whoa! How is this humanly possible?
Yeah, so this isn't a natural response, but
I tracked down Tim to a theatre just off the street, where I'm told he's rehearsing his act. Tim.
Hey, how are you doing?
So the point of this is his neurosignature, the way he experiences pain is different from the rest of most people. Most people can't do what he does. I can't jab a needle in my throat and go and sit there.
Pain defined.
We'll watch a little more of
Is
this.
that something I can see
Then
now?
I'll go to the next one, but this is just the point. Everybody's experiences pain
Oh, that
different.
arm looks real.
People with
Can
chronic
you feel
pain
any pain or no
experience
pain
chronic
or-
pain
I can feel pressure.
for whatever reason.
You can see.
That's a lot of pressure.
Okay, I've had enough of this. Let's move on.
Where's the blood?
Yeah, that's why wasn't he bleeding?
I can't answer that. I don't know. I just know that looked like that hurt. He didn't have any.
He didn't have any reaction whatsoever.
And there are certain conditions, medical conditions out there where people don't feel anything,
Yeah,
but they're very rare.
you know what it looked like too, like going right through turkey skin, chicken skin.
Yeah, yeah. So this one's extreme sensitivity to pain, and I've actually witnessed this in my clinical practice as well. It's not that bad.
Extreme sensitivity. Oh, okay. This is really touchy when it hurts.
Okay, so this is a microfilament. It's just a small little plastic filament.
Oh,
And look at that reaction.
yeah.
I mean, that person looks like they've been stabbed with a knife.
Yeah.
So that is a condition called allodynia, which is extreme response to what shouldn't hurt anybody. So the point of these videos is not to get you to cringe or wonder about certain things. It's to show you that pain is a very strange phenomenon in everybody's body. Everybody has a different neurosignature, which is how they respond to pain. There's women that can have babies without any sort of pain medication. Other women, they need to have the morphine drip to have a child. It's strange how it works. Now, neurosignature is a topic for a different day. It's basically how your nervous system's wired. Okay, let's move on. Let's talk about the Burroughs Clinic, my business, and how I can help solve your problem if you're dealing with chronic pain. All right, so the first thing I would do if somebody has chronic pain, educate them on the appropriate way to start a therapeutic movement practice, or you can call it exercise. I like that term because it makes me sound smart. Myself and people I coach or work with, I usually tell them to set a program 3 or 4 times a week, 25 minutes where they set aside time to move their body, exercise their body to help achieve all those benefits we talked about earlier. 25 minutes is all you need. You need to do less than 20 minutes. It can be done anywhere. The reason I say make your area easy accessible is because people always use time as an excuse. It is an excuse. I use it sometimes. But if you're able just to get it done and get back to your life, you don't have any excuses. What drives me crazy when people drive 20 minutes to the gym to walk 20 minutes on the treadmill. Where do you get all the time to do that? And why don't you just walk outside? I don't get it. But anyway, that's a topic for another day too. So as far as the therapeutic movement prescription or exercise program is concerned, 3 key principles I teach people is the principle of variety, consistency, and sensibility. Variety is do a bunch of different things within what works for you, and that's where the coaching and education comes. Consistency is doing it on a regular basis over the course of time, because physiological changes just don't happen with one exercise or movement session. Sensibility is doing a program that works best for you, that's not going to cause you any adverse events. Okay? It's not going to overly exhaust you, it's not going to stress you out, it's not going to cause any injury. And that's where the coaching and the instruction piece comes into play. That's where I help people out. I help them develop the best program that's good for them. All right, so natural movement demonstration. I'm going to make this brief. Natural movement or therapeutic movement is just moving your body in space. Okay. There's all different positions. This is the standing position. So, I'll teach people simple range of motion exercises. Addressing all areas, especially the area that might be bothering them. Okay, that's one position. You can also stagger your feet and do different. There's all sorts of different stuff you can do. You can go into a half kneeling position and do things. You go to a tall kneeling position and do things. And all this is based on what the patient wants to be able to do and what they can do. Okay, we go down to a full kneel position and so on. And what I do with the people I work with is I figure out what they want to achieve out of the exercise program. If it's something else besides pain relief, you evaluate them on what they can do, and you teach them how to do these movements with or without weight in the parameters that work for them. And you do it over the course of time. You develop functional capability, you develop that pain relief associated with exercise. So that's one thing I do with people. All right, health coaching. Another aspect of my practice and my business. I teach people how to eat an anti-inflammatory diet and how to prepare their meals properly. If you go anywhere in this country, we're set up for trouble, for problems, because there's junk food all over the place. And I'm sometimes guilty of eating it too. But what I teach people is, plan ahead. You're not going to be susceptible to going to Burger King and getting a double Whopper or something like that, which is okay once in a while. It's not okay every day. Teach people about healthy fats and how they benefit your body, which include olive oil, avocado oil, butter, and stuff like that. Avoidance of processed food or industrial foods. Those are very inflammatory foods. The more you eat of that, the more inflammation builds up in your body, the worse it is for your pain. Okay. They're unnatural foods, if you want to call them that. Teach people how to optimize nutrition by eating whole foods, or foods that are closer to the earth, as I like to call it. Teach people about getting out in nature and getting some sun and moving their body the way that God has intended us to move, and not sit at a desk clicking a button all day long. And teach people about proper sleep habits, because sleep is very important in your health, because during your sleep cycles is where the healing occurs. Also, I teach people how to
calm their nerves down. It's just a fancy, this neuro down regulation is basically a fancy way of teaching people how to calm themselves down, because in this society, as well as most Western societies, all of us have a lot of stress. Everybody has it. I have it. I have it every day. And I know everybody in here has probably had stress at one time or another. Stress causes an increase in stress hormones such as cortisol, which messes with your body and can mess with your pain cycle too. Pain response. So stress reduction, decrease in stress hormones. The type of exercise I teach is calming exercises as well as visualization practices to help decatastrophize your pain. So if you have chronic pain, I come down and talk to you about how to use your mind to help calm the pain down. It works. It takes a while. It doesn't happen over the first session. That's why regular practice is the key. Typical prescription would be 3 to 4 times a week for up to 20 minutes. And this involves prayer as well too. Okay, so call to action for people with chronic pain. I would tell them to move your body therapeutically in a way that works for you, with increases over time if you can tolerate that. What that does is help decrease your pain in the long run. I would tell people to be aware of the things you put in your body. Simple phrase here is put junk in, and junk will come out. And that includes not only bad foods, but other harmful chemicals such as alcohol and tobacco and things like that. And what that does is it's going to help decrease your systemic inflammation over time. Take care of your nerves, take care of your body, take care of your stress through lifestyle measures. Nurture your body with whole foods, or what I like to say is foods closer to the earth that haven't been through a factory and processed. And people with chronic pain also need to address all the components of the BPS pain model. If somebody comes to me with pain, I would typically address the biological part of it, but I would also tell them to get some counseling and whatever help they need to develop a better social social outlet. And then learn to live life again. A lot of people with chronic pain don't like to even get out of their house because they're hurt, they feel like crap all the time, they're not doing things. We take it step by step and teach them how to learn to live life again. Okay, so this is one of the last slides. I thought of this, and I kind of messed with the language here, but the key to mitigating health issues is to prepare your body to do so. Do not pollute your body with harmful chemicals and food or other lifestyle things that is negative. Doing so will expose it to a vast array of potential health problems, including ongoing chronic pain and disease. Strengthen your body's systems such as musculoskeletal, cardiovascular, pulmonary, neurological, immune, fascial, and emotional systems. There might be more to include in that as well. I would actually add spiritual too. All of which will help decrease your symptoms and prevent future health issues from occurring. And if for some reason you become afflicted with an ailment, as we all do, I get pain, I get this, I get that, everybody here gets something. We all get sick once in a while, or something happens. If we get afflicted with something, having all these boxes checked will help your body have a better chance of overcoming it. Okay, so wrapping up here, if you'd like to work with me, there's the website you can contact me on to book your free discovery call. And what that call is designed, it's designed for us to talk about your issues, just to make sure that my teachings and your goals will match up. And then after that, if we have a good call and decide we can work together, we book our first session. I do have an overcoming pain physical therapy program with the Burroughs Clinic, which is designed to specifically address your chronic pain, as well as other programs. So that concludes today's free seminar. I'd like to open the floor to any questions.
What's the best thing I could do in my younger years to make sure I don't have pain going on later in my life?
Great question. Prepare your body to do so. Okay? Live healthy, be strong, be positive, develop good social connections, develop spiritual connections, all those above, and you maintain as a regular practice. It's not something you do one time. You just don't go to the gym one time.
Yeah.
You just don't go to church one time. You just don't, go out with your friends one time. It's a continuous practice over the course of years. And then in doing so, you build your body up. And let's say you have a car accident. If you have a strong body in all those aspects before a car accident, you're less likely to have chronic pain after that car accident. Because a lot of people that have car accidents, because it's such an emotional event plus a physical trauma, all that ties into a cycle of chronic pain that could occur. But if your body's prepared to deal with that through the things we've talked about, you're less likely to have that develop. Good question.
How about, being hypnotized? You get into that at all?
I don't know much about that. That'd be under alternative treatment. To me, if it works, if you want to try it, I don't think it's going to, it might just harm your wallet if you pay somebody to hypnotize you. I've heard of that working for people. I've heard of all sorts of stuff. I've heard of shock therapy. I've heard of all different things. There's no one treatment that's going to help your chronic pain. It's, like I said, multidisciplinary approach. You have to address everything. If you address everything, you're likely to get decreases over time. Chronic pain doesn't go away like that. I've never seen chronic pain go away. I've never had somebody come to the office with 2 years of back pain, me do a manual technique on them, and it's gone forever. It doesn't happen like that. It's a process. You have to respect the process. Hypnotism, it might work. I don't know. I don't know I haven't read any literature on it. Any other questions? Okay. Thanks for coming, everybody.
Thanks.